Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So, as I've told you that we are discussing the seventh unit, that is vital signs. We have discussed in detail about vital signs, and while discussing about it, we came to know that there are four measurements, right? And then we have also discussed in detail about the first and the second measurement, which is the body temperature and the pulse rate. In today's session, we are going to start with the third measurement, which is respiration. So in today's session, I am going to teach you about what respiration is, the types of respiration, the characteristics of respiration, the mechanisms of respiration, as well as the various alterations that can occur in the respiratory rate of an individual. So without any further delay, let's start with this topic. So here, as we all know that respiration is the act of breathing. Here, it is the process which involves the intake of oxygen as well as the output of carbon dioxide. This whole process of exchange of air between the atmospheric air and the blood, and also between the blood and the cells of a body, is called as respiration. So as I've told you, that respiration is the act of breathing which involves intake of oxygen and output of carbon dioxide. So this whole process, of gas exchange between the atmospheric air and the body of an individual is known as respiration. Why do you think that intake of oxygen and removal of carbon dioxide is important? It is important because here oxygen is required in order for the body cells to survive. That is why it is very important that we must intake in oxygen. So what happens in the act of breathing, what happens when you are inhaling this oxygen is that it will be transported from the lungs to the tissues of the body, and then the carbon dioxide will be transported from the tissue back to the lungs. So here, during respiration, during inhalation, this oxygen will be transported from the lungs to the tissues, and while this is happening, then the carbon dioxide will be transported from the tissues back to the lungs of an individual. Here, this process of breathing or respiration are commonly described in two parts, that is the external respiration and the internal respiration. What do you mean by internal respiration? Internal respiration is the exchange of gases, that is the exchange of oxygen and carbon dioxide, which will occur at the cellular level. Whereas in the external respiration, what happens is that there will be exchange of gases, but between the alveoli and the blood vessels. So here in internal respiration, we will be finding that there will be exchange of gases, that means oxygen and carbon dioxide, but it will occur at the cellular level. Whereas in the external respiration, there will also be exchange of gases, but this will be occurring between the alveoli and the blood vessels of an individual. Now moving on to the next, that is the mechanism of respiration. So how does this respiration occur? This respiration occurs by three steps. That is the inspiration, the expiration, as well as pause. There will be a consumption of energy. That is why this inspiration is known as an active process, because here why during the expiration we can see that it is just the removal of the air from the lungs of an individual. That is why this expiration is known as a passive process, whereas during inspiration there will be the contraction of the thoracic as well as of the intercostal muscles, which will be requiring the consumption of the energy. That is why this inspiration is known as an active process and expiration will be known as a passive process. So here what happens is that this presence of the respiratory center in the brainstem of an individual is the one which will be regulating this process, is the one which will be regulating the respiration. Here, as we all know that our brainstem consists of the respiratory center, right? So here this presence of the respiratory center in the brainstem of an individual will be the one which will be regulating this process of respiration. So what happens here is that during inspiration, which means when you intake this oxygen into the body, the respiratory centers which is present in the brainstem will be sending the impulses along the phrenic nerve, which will then lead to the contraction of the diaphragm as well as the other organs such as the abdominal organs. to move downward and forward, and also here the thoracic cavity will expand with movement of air inside the lungs. And also you will be finding that in a normal breath a client can inhale 500 ml of air. So this is what happens during inspiration, whereas during expiration, as I have said, that this is a passive process, right? So here, when you are breathing out carbon dioxide, the diaphragm will get relaxed, because when you are breathing in, the diaphragm will get contracted, right? But here, when you are breathing out, the diaphragm will get relaxed, as well as the abdominal organs will return back to their initial relaxed position. So this is the mechanism of respiration. Now let's discuss about the regulation of respiration. So here, as we all know, that the normal breathing rate of an adult is 14 to 18 breaths per minute. So here the ventilation in the body is regulated by the level of oxygen, by the level of carbon dioxide, and the arterial blood pH. So here, as I've said, that respiration is controlled by the respiratory center, which is present in our brainstem, right? So what happens is that these respiratory centers will be the one which will be increasing the rate and the depth of respiration, and this will lead to removal of carbon dioxide from the body by the process of exhalation, and then this would lead to an increased oxygen level, which would then lead to oxygen consumption in the cells, which would further lead to the increased carbon dioxide in the blood, and again this will send a signal to the respiratory center. So this is the whole process through which this respiration occurs. This is the regulatory mechanism of respiration. Here what happens is that the most important gas that triggers the respiratory center is increased carbon dioxide level in the arteries, right? So here what happens is that these respiratory centers will be sending impulses in order to increase the rate as well as the depth of respiration, and due to this, more oxygen will be taken in by the lungs, and then the carbon dioxide will be exhaled. So here, as soon as the oxygen is consumed by the cells, the carbon dioxide will then be produced, and this is how this cycle will keep on continuing. However, if you encounter any client who may be suffering from COPD, then you may find that, the opposite might occur. That is, you will be finding that the carbon dioxide level which is present in the blood of an individual will always be increased. So here in such cases, the chemoreceptors which is present in the carotid arteries will be the one who will be conveying this message to the respiratory centers which is present in our brainstem, and this will lead to an increased rate and depth of respiration. So here for these type of clients, what happens is that the low oxygen will be the one which will be providing a stimuli in order to allow the client to initiate this process of respiration. So this is the regulation of respiration in a normal individual as well as in client who may suffer from other disease conditions such as COPD. Now moving on to the characteristics of respiration. So here, in order for you as a nurse to be able to assess that whether the respiratory rate of a client is normal or not, it is important that you must know the characteristics of it, right? So here the characteristics of respiration include the respiratory rate, the respiratory depth, the rhythm, as well as the quality. So talking about the respiratory rate, so as we all know that here the rate of respiration is defined as the number of time that the client has took breath in 1 minute. This 1 minute will be including both the inspiration as well as the expiration. For a normal adult, you will be finding that they will be breathing in a steady rate, and also here a breathing rate from 12 to 20 breaths per minute. However, the normal breathing range may differ with different ages, right? So here, for a normal adult or for a normal client, you will be finding that their respiratory rate will be between 12 to 20 breaths per minute. Whereas if you assess the respiratory rate of a child, then their normal breathing rate is from 20 to 28 breaths per minute, whereas for an infant, the normal breathing rate is of 30 to 60 breaths per minute. So when can we say that the respiratory rate is normal? We can say that the respiratory rate is normal if it is within the appropriate range. So as I've told you about the different ranges, right, for different age groups. So if you assess the breathing rate and if you find that it is, within the appropriate range, then their respiratory rate is considered to be normal. Whereas if you find that the patient breathing rate is higher than the normal range, then it is considered to be rapid. And here, rapid breathing is also known as hyperventilation. And also, if you had assessed the respiratory rate of the client and you have found that their respiratory rate is lower than the normal level, then we can say that his breathing is low. And then moving on to the second one, that is the respiratory depth. So here, the depth of ventilation refers to the amount of times that that particular individual has inhaled or exhaled during this whole process of the respiratory cycle. Here, the amount of air which has been inhaled and exhaled by that particular individual in one cycle is also known as the tidal volume. So here, a normal adult has a tidal volume of 500 milliliter. So here what happens is that the more the chest of that individual expand, the greater will be the depth of the ventilation. And also here, subjectively, the respiratory depth will be described in terms of deep breath, normal breath, as well as shallow breath. When is it described as a normal breath? So here, as we know that the normal depth of breathing is hard to determine. Why? Because here the chest will not be expanding to its full capacity with each breath. So here, if a patient is not showing any signs of distress, if a patient is alert and has a normal skin color, then you can consider that that particular client is having a normal breath. And then the second one, that is the shallow breath. So here, if the patient chest and abdomen rise and fall only slightly, then we can say that the patient's breathing is shallow. And also here, you will be finding that this particular client who is having a shallow breath will also have a rapid breathing. If you encounter any patient that has a shallow as well as a rapid breathing, then he can be said to have short of breath. Whereas if the client is having a slow as well as a shallow breathing, then it is called as hypoventilation. And then the third one, talking about the deep breathing. Here what happens is that if the patient's breathing is deep, and also if you find that their chest cavity is expanding to almost its full capacity, then you can say that the client is having a deep breathing. And you will also be encountering this condition, especially for those clients who will be gasping for air. And also here, a breathing pattern which is rapid and deep breathing is termed as hyperventilation. So these are the three respiratory depth, that is the shallow, the deep, as well as the normal breath. And then the next one here is the rhythm. So here the rhythm can be monitored by observing the client's chest. It is also the rhythm that will be determining the regulatory in each respiratory cycle. While assessing, you may be finding that it could be regular and even sometimes it could be irregular. And also in a normal respiration, the rhythm will always be normal. When will you finding the rhythm regular? You will be finding it regular when there will be a normal breathing rhythm. That is, there will be inhalation, then there will be a pause, then there'll be an exhalation, and then there will be a pause as well. And also here, the exhalation phase of the cycle will usually last about twice as long as the inhalation process. So the cycles will be repeated at a steady pace. If you find that this occurs, then it will be regular. However, it will be irregular if there will be a change from the normal rhythm. And also, if you find that the rhythm is not regular, then this can also serve as an indication that there is presence of illness. stillness. And then moving on to the last one, that is the quality, right? So here breathing can be either of a normal or of an abnormal quality. So when can you say that it is normal? You can say that the breathing quality of a client is normal when it does not require conscious effort. It is automatic, if it is regular, if it is even, and if it does not produce any noise, any discomfort, or any pain, then we can say that the breathing quality of an individual is normal. However, if there is presence of pain, if there is presence of labored breathing, if there is presence of wheezing sound, noise, as well as tidal, then we can say that the breathing quality of an individual is not normal or is abnormal. So these are the four characteristics that you should keep in mind while you are assessing the respiratory rate of an individual. Now moving on to the next, that is the factors that will affect the respiration. So here there are various factors that can affect the respiration of an individual. The first one can be the age, the second can be the exercise, because why here, if a particular individual is performing any strenuous activity, then also there will be changes in the respiratory rate. And also here, if the client having certain emotions, then this can also lead to an alteration in the respiratory rate. And also if the client or if that particular individual has the habit of smoking, then it can also alter the respiratory rate of that particular individual. And also the body posture. So you may be thinking how the body posture can affect. Here, the posture which you are in, suppose now if you are standing straight or if you are sitting straight, then this will enhance the chest expansion, whereas if you are lying down, this chest will not be able to expand much. That is why whenever we encounter any client who is having difficulty in breathing, we provide the semi-Fowler's position. Why? Because we cannot expect them to sit straight, we cannot expect them to stand straight, right? So in order to facilitate this normal breathing pattern, we provide a semi-Fowler's position. And then medications. So if a client is under any medication such as opioids, such as general anesthesia, such as sedative, dilate the airway. And also the next factor is the metabolism. So any changes that can occur in the metabolic rate of an individual due to the hormones can also alter the respiratory rate of an individual. If the client has suffered from any injury or any trauma, then this can also alter their respiratory level or the respiratory rate. Why? Because this will impair the brain stems, right? And then this can also affect the rate and the rhythm of the respiration. And also pathology such as the anemia, such as the sickle cell disease, where the oxygen carrying capacity will not be fulfilled by the red blood cells, can lead to increased respiratory rate and the depth of respiration. And also here, if the client is suffering from any pain, then there will be also changes in the rate and the rhythm of the respiration. So this will lead the client to take a shallow breath. Why? In order to reduce pain, right? That is why this can also alter the respiratory rate of an individual. So these are the various factors that can affect the respiration. Now moving on to the next, that is the alteration in respiration. So while you are assessing the respiratory rate, if you have found that there is any alteration, then depending on the condition, you can term it as follows. So the first one is apnea. So while you are assessing the respiratory rate and you find that there is absence of respiration, then you can term it as an apnea. And also if you found that the client is having difficulty in breathing, then you can also term it as dyspnea. And also if the client is having difficulty in breathing, but it is relief if he or she is sitting or standing in an upright position, then it can also be termed as orthopnea. If the client is taking extra effort in order to breathe, then we can also term it as labored breathing. If there is a very deep inspiration which will be followed by a prolonged expiration, then we can also term it as a sigh. This sigh is somewhat similar to yawning, okay? But here, while you are assessing, before you term it as sigh, you must make sure that the client does not suffer from any anxiety, because here, if a client is having anxiety, then it is very common that the client may take repeated sigh. If the client is having a high pitched crowing sound during inspiration or during the intake of air, which can occur because of blockage in the upper airway, then it can be termed as stridor. If there is a snoring sound which can occur because there is a presence of secretion in the trachea, then it can be termed as stretter. If there is a high pitched whistling sound which can be produced due to partial obstruction in the airway, then it can also be termed as wheezing. If there is difficulty in breathing, which is also characterized by dilation of the nostrils during this process of respiration, then it can also be termed as the nasal flaring. If there is a bluish discoloration of the skin because of the lack of oxygen in the tissues, then it can also be termed as cyanosis. If there is absence of oxygen in tissue, then it can also be termed as anoxia. If there is lack of oxygen in tissue, it can be termed as hypoxia. And if a client is suffering from a state of suffocation, then it can also be termed as asphyxia. And then the next is the chain stroke respiration. It is a cycle of the decreasing rate, decreasing depth, and a pause, and as well as a decreasing rate and depth of the respiration. So here, if the client is suffering from this chain stroke respiration, then he will be having a decreased rate and depth, which will be followed by a pause, and also again it will be followed by a decreased rate and depth, okay, of the respiration. And then hypoventilation, which means decrease in the rate and depth of respiration. And then the next one is the hyperventilation, which means increase in the rate and depth of the respiration. And then comes the Kussmaul's respiration. So this involves increase in the rate and depth of respiration, which will be accompanied by an audible sound or by an audible sigh or gaps. So if you find that the client is having this, then it can be termed as a Kussmaul respiration. And then the last one is the Bitot respiration, which means an abnormally shallow 2-3 breath, which will then be followed or accompanied by an irregular period of apnea. So these are the various alterations in respiration. I hope you guys have got a clear understanding of what each means, okay? So now here we have come to the end of this topic. So in today's session, we have discussed in detail about what respiration is. I hope by now you guys might have got a clear idea about what respiration is, what are the two types of respiration, what is the mechanism as well as regulation of respiration, what are the factors that can affect the respiratory rate of an individual, as well as the alteration in respiration. I'll be meeting you guys in another session whereby we will be dealing with the fourth measurement and the last measurement, which is the blood pressure. So until then, have a good day. Thank you.